the voice. Is it affected by fibromyalgia? Well, what do you reckon? Anyway, welcome to Fibroman. But there has been a study on how fibromyalgia affects the voice. Now, I found this quite interesting. But the test, or the examination, the study, was performed on women. 30 individuals. They did a series of examinations and tests and what have you, to see how these individuals with fibromyalgia, how their voice has been affected by the fibromyalgia. Now, I, for one, as you can probably tell, have got some vocal issues, okay? I get criticised for not being clear and not pronouncing my words properly and stuff like that. But I talk in a certain way because I actually struggle to speak. The annotation of it all, it helps me to be able to get my words out. It's not easy sometimes, but I didn't used to always be like this. I used to have quite a high-pitched voice. People used to think I was a lady on the phone, you see. I used to go along with it because I thought it was funny. But today, I don't think I could do that, no. Now, in the study, okay, it clearly shows that fibromyalgia impairs perceived voice quality. Now, for me, my vocal range has been squeezed. Now, I used to sing like an angel, I did. No, obviously not. But anyway, I could reach my pitch, basically, could be high or it could be low, and these days it feels like it's been contained. Now, in the study, it clearly shows that fibromyalgia impairs perceived voice quality, either in patient self-evaluated or clinician-evaluated rated scales, or rating scales. Furthermore, the results confirm that the respiratory system disorder, basically lower pressure in the pulmonary, in the lungs, and that also affects your ability to produce enough. I don't know if it's the air or I don't know the vibrations across the vocal cords. Well, it's certainly doing something. But see, the results confirm that respiratory system disorder related to fibromyalgia cause a decline in aerodynamic voice measurements. So the flow across our vocal cords, for somebody with fibromyalgia like myself, is much lower. Hence, they're not vibrating as fast. They call it short MPD. Well, and a considerable decrease in voice intensity. Yeah. Yeah. Audible perceptual characteristics of voice, pitch, intensity, and quality are defined by air expelled from the lungs and the vibration of the vocal cords. That makes perfect sense to me. I feel, like I say, I'm constrained. I feel like I just don't have the ability to just get the words out sometimes. I just really struggle. Not necessarily what's going on up there. I know what I want to say. They just don't come out as they should. It's constrained, it's squeezed. And I feel it's getting worse. It definitely has progressed, especially in the last year. Now, I've been having these vocal issues, quite severe vocal issues, since probably October last year. And they've been getting worse and worse and worse. Many YouTubers, because I've got other YouTube channels as well, you see, woodworking. Got a woodworking YouTube channel, it's called Wally Boy if you're interested. Wally Boy Woodworking. And I have to really manage myself to actually get my channel, my videos made. I can't just make my videos. I'm a bit mad in some ways, you see, but it's just, I find it really difficult to actually just blurt it out. You know what I mean? I've got to really be measured in what I do. Otherwise, I just can't get the words out as they should be. Anyway, in conclusion, perpetual assessment of the voice on the study I'm talking about, either clinician evaluated or patient self-evaluated, is impaired with patients with fibromyalgia. The result demonstrates that fibromyalgia deteriorates perceived quality of voice, vocal intensity, as well as a maximum phonation time, so that's the length of time the vocal cords are being vibrated, or significantly decreased. However, Other voice analysis parameters including fundamental frequency, jitter, shimmer, and the harmonic to noise ratio did not reveal any change. Oh, I see. The respiratory system disorder related to fibromyalgia seems to cause short to maximum phonation time. Well, I'll leave a link for that in the description down below. There's a lot of technical stuff in there that most people wouldn't want to be bothered with, I must say. But it's that's if I can find the link again after I put this video up, because usually what happens, I usually lose things. But it's not easy. It's not easy because not everyone understands, you see. Some of you met me for the first time just think I sound weird. Some of you comes across my videos for the first time do not understand or want to attempt or even try to understand that I have a problem and I struggle to speak. People around me don't get it either. They don't understand because they just carry on blurting at me, and I have to, ask questions or try and create conversations, which I understand. Obviously, I understand, but I have to prepare myself to speak. Like just making this video, I've literally been. I come here sometimes just to get peace and quiet. I've got grandchildren over at the moment, and I just come here just to get a bit of peace and quiet. So I maybe have a little bit of a snooze, what have you, because I get a lot tired, a lot of fatigue these days. So I have a bit of a snooze. And then I thought, hang on, it's a good opportunity to make a video because I'm not quite as tired as I was. Well, a bit droopy. Drowsy. Droopy as well, but anyway, drowsy. But I have to be kind of measured in everything I do, especially regarding my voice. And it's especially difficult because my dear wife, she's partially deaf. She has her hearing aids, but the hearing's quite bad still. So having a conversation or she asks me questions, I have to repeat myself a lot. And it doesn't help. It really doesn't help at all. It's not her fault, obviously, but it makes things even harder. And it gets frustrating as well. Because I don't actually try to speak sometimes or respond even. Especially if she's asked me a question and she walks into another room immediately afterwards, which seems a bit of a silly thing to do. If you're deaf, you're never going to hear the response, are you? So, people. So strange as folk, they say. So yes, it does appear that fibromyalgia is another, that it does actually affect the voice. Whether it's the fibromyalgia affecting my voice, or is it maybe GERD or something like that, where you bring an acid up and it affects your vocal cords, they get damaged. I can't confirm that. You see, the doctors and that, they're not specialists in the field. See, my doctor who's just literally just put down that I've got fibromyalgia, and I've had loads and loads of tests over a very long period of time at a variety of different clinics, but none of them are fibromyalgia specialists. They just test you for this and test you for that, and the conclusion is they've got fibromyalgia, and I've had all the pressure points, and whether that is what's causing that, it might not be. That's the problem, with fibromyalgia. The problem with fibromyalgia, it can mask or be, not an excuse, but it could be a blanket diagnosis for other symptoms. And this is where people must be very careful that doesn't happen. You need to be aware of your body. You need to have a good understanding what is going on and do your research, because something serious could be masked by fibromyalgia. Anyway, time for me to go. I'll say toodaloo now. But please, if you've got a problem with your voice, leave it in the comments down below if it's related to fibromyalgia, or even it's GERD or something else that's causing you vocal issues. Well, please beep the old like button. Helps the channel, Toodaloo.